Stella. Stella's was with us before we started this morning. She's from Switzerland and just was planning on opening her own practice April 1st. So you want to just briefly go over that real quick with the rest of the group, since we've got a bunch of people in here now?
Yeah, sure. Oh, sorry.
Oh, there you go. We got you.
Can you hear me? Yeah.
Yep.
Yeah, so I've been planning to open my own practice for quite some time, more than 6 months. Everything is more or less prepared, and we're starting. I have 3 nurses on my team, all working part-time, and we're starting out April 1st. We're not seeing clients as of April. We're gonna prepare the practice with all the supplies and the software and everything, doing the inventory, and then we start May 1st seeing clients. But obviously right now, as we're on lockdown, we're just supposed to see emergency cases. And yeah, I'm still in the middle of preparing how we should handle the whole situation also with my nurses, because it's me and 3 of the nurses, so I cannot really split up any teams. In case we have somebody getting sick, it's going to be very, very difficult. We're going to have to shut down completely again immediately, which is very difficult. And plus, we don't have a lot of supplies. So that's the next thing we're going through right now. I'm doing day and night. I'm trying to get whatever supplies are left and trying to find solutions on how to how to handle them carefully, or just deal with what we have and look for other solutions, like, yeah, re-sterilizing gloves, sewing masks, whatever we can do.
Excellent. Stella, thanks so much for sharing that. You know, that kind of brings up a question that I see Mark Steiner and Danielle Heberly are here, along with Linda Papalardo from Midmark. You guys probably have your finger on the pulse of what's going on in distribution, not only with Midmark, but also with maybe some of the other companies that distribute. You're in direct contact with your distributors, I'm sure, that distribute not just dentistry and anesthesia, but also everything else that everybody uses in general practice. Can any of you speak to what we can expect, or what's going on in the distribution channel? Is that going to be potentially a problem, or maybe it is already and we just don't know about it?
We have been in oh, Linda, were you going to speak?
No,
you can go ahead. We have been in contact on a regular basis with a lot of our distributors, and I think right now they're not sure either. You know, they're still trying to adjust to not being able to go in and actually speak with clinics, and so that's been a big adjustment for them. And then I know, you know, of course, there's always you know, wondering if they're going to be able to even ship anything out, because everybody that's in those warehouses that are packing the orders, is there a risk at that level too? And so I haven't heard anything specific. Maybe Linda, you have, but I know that this has been a big adjustment and concern on their end as well.
Linda, did you want to add to that, or that pretty much cover it?
That's pretty much the same that I've been hearing as well. Yeah.
Okay, excellent. Thanks, Danielle. Appreciate you sharing that.
Sorry if I just may pop back and add something towards all the supply chain, keeping that up.
Exactly.
From the things I've been hearing in Switzerland, but in Europe, or all over Europe, there is massive issues. I mean, all the hygienic stuff, like the disinfectants, the masks, the gowns, the gloves. I'm not really speaking about that. Was yesterday. I was worried about that yesterday or last week. What's coming up now is anesthetics is a major issue. So they're selling out on all the isoflurane and all the inhalation anesthesia stuff, and also the injectables. So I'm trying to adjust on my anesthesia protocols because I'm not sure what I'm going to get anymore. Plus, I mean, we also have to be, or we have to deal with the human situation that we're in. So I also try to preserve and leave towards human medicine if we can adjust our protocols. Obviously, we're just doing emergencies, but anyhow, we still need to have some anesthetics on hands. I've been in contact with anesthesiologists from human medicine. They told me that they're mostly using propofol, inhalation stuff, and opioids, highly dosaged opioids. And I've been in contact with the suppliers. For example, in Switzerland, I'm not sure I should give any names here, but we have hospitals, human hospitals now, that are going to the vet suppliers and they're buying everything. And that's not just the anesthetics, that's also the tubes, the anesthesia tubes that they're getting. So we are really running out of supplies.
Wow. I see Elaine is here. Elaine's in France. You experiencing the same thing, Elaine? I just unmuted you, so you should be good.
Do you hear me?
Can hear you.
Yes, you are hearing. I am retired just 1 month ago, so I sold the office. But my wife is still working, but we have no problem for masks and gloves.
No problem.
With our dealers.
Wow.
No. Okay.
Well, I wonder can you guys in Switzerland access distributors outside of Europe, or I mean, he's in France, and David in the UK right next to him.
Yeah, we're on the border to France, Italy, and Germany, but we're not part of the EU. So what's happening, that's not just for the vets, obviously, that's also a major point of discussion for human medicine and all the hospitals. They're blocking a lot of supplies at the borders because the countries want to keep them for themselves.
Wow. Yeah, that's interesting. And David, anything to add to that?
Yeah, at the moment we seem to be getting everything that we need. But I think I'm going to have to look at our stocking levels and maybe increase them a little bit just to make sure that we don't run out. At the moment, it's all right though. But you know, as you know, we've recently come out of the EU, so we may have the same sort of problems that people are experiencing elsewhere. But
yeah,
so far so good.
I wasn't aware of that, and I'm sure you guys weren't aware of all that going on over there. That's really sad and interesting, but sad.
I have a question about ventilators.
Sure.
I have 2 Hallowell ventilators, and now I'm getting pressure from other people that I should donate these ventilators to human hospitals. But as far as I understand, the ventilators we use under anesthesia are a different type of ventilator than the one that they are using with conscious patients to aid ventilation. Do you have any comments about that?
Sorry, I'm not sure, Brett, whether you want to answer. I can just, I'm sorry if it's always me, but
no, that's
sure.
great. I have no idea.
Just I really want you guys also to take advantage of what's going on in Europe right now and what the current situation is with us. I still think, I mean, Switzerland is not, it's not a third world country, and it really amazes me what's going on right now. For the ventilators, I can just tell you, we have 2 main vet hospitals in Switzerland, which are large ones. One is in the capital of Switzerland, and they have been forced, more or less, to donate to human medicine. So we all got a newsletter from like there is a community where all the vets are in, and we all get this newsletter, and everybody was asked to donate, if possible, their ventilators if they have something available in practice. However, I have to add to that they also mentioned that the ventilators that are being donated to human medicine, they're running checks on them because obviously they might not be as hygienic as they want them to be, but they do work for all the people who are in, I don't know how you call it, like under full anesthetics. It's like an artificial coma, and then they can use them, yes.
I can add to that.
Oh, I'm sorry. No, go ahead, Jennifer.
I know in the state of Maine, when this first all started, we had about 100 ventilators in our state only. Last I heard, that's been up to 300. And I've also heard that, you know, they're looking at extreme situations where, you know, there's not enough ventilators to go around, but someone's going to die without one. So even putting couplers on ventilators to run on more than one patient at once. So that's how extreme this could get. So, you know, if it's a choice between someone dying or living, then I think that they probably would try to retrofit or use a ventilator that's used in veterinary medicine. Obviously it wouldn't be ideal and it would be a last resort. But our state is doing the same thing and asking all of us to donate as much as we can possibly donate, you know, without sacrificing too much that we need. But obviously we're all facing a really hard situation where we're veterinarians, that's what we primarily do. And so we're looking out for our patients and what we need to do. But we also have to balance that with human needs too.
Excellent perspective. Sandy, does that help?
Somewhat, but I don't. The next question is, how do you go about donating something? Nobody's approached me. So I'm in Vermont. So how would I even go about doing such a thing?
I would contact your state vet if you are interested and want to donate. That's who's been contacting us about donations, is our state veterinarian.
Okay.
Dr. Beckman, this is Danielle with Midmark. We'd like to get back to everybody on that because we do offer ventilators at Midmark, and from what we understand, these are not would not be a good solution for the situations with COVID right now. I'm trying to get more information as we're on this call, but I could send you a follow-up that maybe you could share with everyone once I get more detailed information for you.
Yeah, that would be great.
Brett, the Emergency and Critical Care Society has a list that you can put your ventilator type and where you're at and whether or not you're willing to donate it locally or otherwise. And they're compiling that, and then you can see all the ventilators that people have and what kind. And they should be able to coordinate it from there. Also, we have found that not the Zoom, but the iPad FaceTime works amazing for seeing clients. It almost is like you're in the room with them, only you don't have to put up with the stale cigarette smoke and all the other things that they bring with them. We have an iPad that we got so that we could use your software, and then we had an iPod, and we let the owners use the iPod if they don't have an iPhone. They have to be relatively close, which means they have to get out of their cars to do it. But if they have an iPhone, we can do that. I'm told we can do the same thing with Zoom, but it hasn't worked for us yet. Anyway, that's something that worked for us.
Excellent. Thanks, MJ. Yeah, that would be a good resolution for that Sandy, what Jennifer had mentioned, what MJ mentioned, both those resources, emergency and critical care and your state vet. I think that makes sense. Brandon, do we have any questions in the chat that we need to?
Nope, but there was a
address?
comment about tech savvy or 3D printing N95 filters to fit older and veterinary machines for human use. So very interesting. Also, I thought having a practice iPad and a practice iPod that can connect in FaceTime is a great idea. So that's a great solution.
Excellent. Well, and chime in on any of that too, Brandon. Brandon's kind of he's kind of like me. He's a bit of a tech nerd, only he's more so, and he knows that I call him that, so it's not a bad thing. So if anybody has, or if you have anything that anybody can use in that respect that we haven't talked about, that you're thinking about, you know, feel free to share that.
So Jennifer just mentioned Skype could be a good option as well. I do think that Skype's a good option. The only problem is that the adoption rate for Skype is not super high. And so when you're looking at telecommunication stuff that people want to use, you need to use something that works across Android and iPhone, which is why FaceTime doesn't work for everybody. But you know, Google Hangouts is a good option for Android users, and FaceTime's a good option for Apple users. But that's what you're trying to do, is just get a solution that covers almost everyone.
What's your thought on Zoom, using Zoom for that?
So I think Zoom's great because it's very consistent across all devices. And so if you've never used, well, you're on Zoom right now, but you can get a free version of Zoom and you can have unlimited one-on-one meetings with Zoom. So it works very, very well, and it's easy to invite people to. You just have to send them your meeting link, and then it works pretty seamless. The mobile app is great too, I think. I'd like to see if anybody else is using Zoom. I know a lot of practices are using Zoom right now. So
yeah, and Zoom's pretty much non-tech needed as far as getting on a call with somebody that sends you that link. If you're on the phone and you've sent the Zoom invitation to the client, all they have to do is click once and it automatically takes them to the room. And if you guys have used any kind of software for meetings before, you've got a meeting ID that you have to put in that might be 6 or 8 characters, and you have to put those in your phone and hit pound, and it's just a mess. But with Zoom, you could literally just send them the link, and they click on that number, and it takes them right to the call, to the video call. So really would be another great option for you.
yep, definitely.
Cool.
I think that would work really nicely with us, especially. And again, this is all new because we haven't really seen patients as of yet, but I would like to try that and see how seamless that is for the new patients that have not met you, haven't seen you, face to face, to try and make that a little bit less stressful for them to be able to talk to you face to face. So, and again, without me having to touch their devices to help them, if it's that easy, that's the other thing we have to think of. We can't be touching their devices, and I don't want them touching our devices, which reminds me of the other concept that people were doing with payment and even signing consent forms. We're paperless, and so we do everything on the iPad. And so I think, Brett, you had mentioned that some folks were saying, do you want us to sign for you so you don't have to touch any of our devices? Of course, we're, disinfecting between each patient or each person, but to have that minimal contact between devices. And so if the Zoom meeting is that easy and the owner can do it that easily without me having to take their phone and walk them through it, which we would do in normal circumstances. But if I don't have to touch their device, they don't have to touch our devices. I think that helps in keeping that transfer to a minimum as well.
There is one other thing that we're doing, and we've been doing it for 2 weeks now. I got one of those Echo Dots, although any of the other things would work also. And we set it to go off every hour. And it's just like Pavlov's dogs now. Every hour when it goes off, we go and everybody in the hospital washes their hands. Since we've done that for 2 weeks now, nobody's had a cold, nobody's had the flu, nobody's been off for anything. We are split up in teams. We're doing all that other stuff too, but really making everybody come and wash their hands every hour seems to have been the key for us.
Good, thanks, MJ. You know, one thing that came out on our meeting Sunday, and a lot of you are here that were at that meeting on Sunday, we are like as a veterinary profession, we are like the healthcare workers and the Red Cross people to a certain extent, because we are there and we're still seeing patients and we're caring for those patients during a crisis. And so the pet owner and client bond, even though it's compromised from the distancing, I think cannot help but be permanently cemented during this time, just because we're here for them. And it brings up the question as to what is essential and what is non-essential. And I don't think there's any really concrete answer that we'll ever come up with on that. But I think we also have to keep in mind what the client perceives as essential and non-essential to some extent. I mean, not let that sway our decision dramatically, but we still need to think about that and put it in that big perspective that, you know, they look up to us more now than they ever have, and probably will continue to do so. And I've heard a lot of people talk about the impact on the medical profession just because of that, putting people all together in this thing and elevating their status beyond anything that we've ever had in history. So we're in an opportunity phase to really high touch our clients without getting near them. And I think that overwhelms the distancing that we're having to impose to take care of the pet. As long as we're there on the phone, and especially if we can do it where we've got video and we can be looking at each other, that I think that's a huge component.
One thing that maybe hasn't been mentioned too with using telecommunication is there are programs out there. I know my clinic is looking into it that are like official telemedicine programs. So I know the program my clinic is looking into is called AnyPanion. I don't know much about it. The corporate that we just partnered with is doing all the research to figure out how that works, but it would be more kind of an official telemedicine kind of program.
Interesting. Jennifer, I would love to say the name again of that.
AnyPanion.
Okay, I'll look into that and see what that involves. It's kind of hard to imagine that there's not a free alternative to that with all the ability that we have. Brandon, do you have any experience with that? Have you talked to Brandon talks to veterinarians every day and has a lot of them as clients, or have had a lot of them as clients in his marketing. But you have any experience with any of those telemedicine software systems?
There's a bunch of solutions out there, and I think that when you find one, you want to make sure that the user experience is good, because if it's a difficult user experience, it's going to make it just painful to use, and it's going to end up not working. So I know that there's like Televet and AnyPanion and just a bunch of options out there. They pretty much all do the same thing. I think the major kind of benefit of having an actual telemedicine app is that they're built in for payment collection. They have record keeping integration and things like that is important. and I have never worked in a clinical setting, so I can't comment on that kind of stuff, as far as how difficult it is to keep records if you're using Zoom or something. But I mean, there's other options too out there. I think just really making it simple on yourself and the client from a user perspective is just so important. So, you know, if there's any bugs in, and it needs to be tested on both Android and Apple devices, especially, you know, a lot of problems with Android devices is that people don't update them. Apple forces you to update, and that's why it's such a consistent user experience. And so you have to kind of think of the least tech savvy clients that you have. Would they be able to use it, and would this help you or hurt you? And is there, you know, Zoom is very easy to use. It's not the same level of like professionalism that these other apps have, but I think that you know, it just really depends on what you are looking to do with this. There's programs like Calendly, which are scheduling calendars, and I created a training on that, how to set up a Calendly account and integrate it with Zoom so that your clients can choose a time. And if you start transitioning to fully telemedicine appointments, you can set it up so that it automatically sends appointment reminders and is hands off once you get it set up. And then the client can go and pick a time on your calendar that they can then meet, and you can also collect payment with that. So depending on what you're doing, I think it just is going to matter on what your end goal is mostly. But I do think that there's huge benefit in telemedicine. I've used it in human medicine with my daughter, and it just was incredibly convenient. I don't know all of the features that these other telemedicine apps have, but they sent the prescription through it and prescribed, you know, medicine, and it was amazing. So I'm a big fan of it personally.
Excellent. Anybody have any other comments in those along those lines?
I'll add one. Oh, go ahead.
Can you guys hear me?
Hey, Mark. Yeah, go ahead.
Yeah, I just wanted to. I'm on another listserv, and this very subject popped up. I'm totally unfamiliar with any of these. However, the list that was sent to the listserv that I'm on said AirVet, Anapanion. There's another one, Vet Now, Teletails, and Televet. So those are 5 of them that popped across my listserv. Another one said if you're interested in after hours triage, there's one called Guardian Vets and Pet Triage, and services that provide general advice, Whiska Docs, DOCS, and Ask.vet. So that just gives people different ideas. And I also had another question for the group with Zoom, because Sunday was the first time that I've used it. Once you start using Zoom, for those of you that are using it to talk to your clients and use it in that way, do they have to download the app, or will their phone immediately go to a website so that they can talk with you over?
Brandon, you want to speak to that?
Yes, it will send you to an app download for the meeting on mobile.
And pretty seamless, right?
Very seamless. Yep.
I had to do that in order to get the video on my phone today, and it literally just took about 4 or 5 seconds. I'm logged in on my computer because I can see everybody, but then on my phone, you can hear me and I can hear you because I turned off the audio on the other. I am using Meducci app. It's a human medicine telemarketing thing. It's $150 a month, which seems to me a little bit high, but it seems to work. And OVMA had a meeting about it, and the guy spoke for 3 hours, spoke highly of it. We've done 3 or 4 consults now, and it does seem like it works. And The one thing I would say is when you're doing this, a lot of times clients can't take a picture worth beans on their phones. So if you have them take a video, you can stop the video when it shows what you wanted to see. Our very first client that did this had a cat with ringworm, and the MD had diagnosed the ringworm, and she wanted some ointment for her cat. And we said send a picture, so she sent pictures of her lesions, which I didn't want to see in person. I didn't want to see in the app, and we said no, send a video. So she sent a video of her body, and I didn't even look at that one. But when she finally got around to sending the cat has ear mites. And the cat looks, as you would expect, perfect, but the video allowed you to see all of the cat, and then you could zoom in on the part where this cat had scratched its ears because of the ear mites. So the video is a key thing on this.
Great point. As you can tell, MJ doesn't sugarcoat anything. Jennifer, did you have something else to add when we were back on that a second ago?
I was just going to say, as far as the telemedicine thing goes, one thing we're all trying to take from this horrible situation is to try to come out stronger at the end. So if financially it makes sense to look into some of those programs, official programs for telemedicine, maybe that's something that can be added to your practice that clients will appreciate even when this is over. I don't know the financial side of it. I don't have to pay for it. I'm very fortunate right now that I don't own a practice probably. But that's just, something maybe positive to take from it.
Excellent. Thank you. I see Vivi, I see you're on. Vivian's from Brazil. I'm going to unmute you and maybe give us some perspective about what's going on there.
Sorry.
Yeah, it looks like she's having some broadband.
Can I ask what people are doing with their staff and what we're thinking? We all think this is going to get worse, and right now we've split into teams which cut payroll by 20 or 30%. But what are we looking at for the future?
I can speak to that a little bit. It's certainly not as much the future, but what you can do now. And we are fortunate to be involved with a group of really smart business people, and we've had multiple meetings over the last couple of weeks on this very platform. And one of the recommendations was that we don't know how long this is going to last. It may last. Some people are saying 18 months. Some people are saying April 15th, but it's uncertain how long all this is going to last. So it's prudent for all of us to realize that now before it gets worse. And if we can make arrangements with multiple lines of credit and multiple arrangements with existing bills and things to delay anything, it would be in our best interest to do it in general, but also do it now until while you don't need it, so that when you do need it, it's there. For multiple reasons. Number one, if you wait a couple weeks and everyone's putting in SBA 7 applications, then it's going to be very difficult for that to get facilitated maybe by the time that you actually need it. And the other aspect of that is if you do it now and you do all of these things at once, for example, if you call your bank and have a extended line of credit, and you call your credit cards and up your credit card limit, what's going to happen is all those inquiries in your credit card or in your to your credit from those entities is going to happen at once. And so they're not going to perceive that you're looking for multiple inquiries, because they won't see multiple inquiries over a period of weeks. And I had no idea that was even a factor. But the recommendation from my business group is that if you do everything at once, you put in everything at once, then you're not going to have the subsequent entities seeing that you've had inquiries into your credit, which may be something that they might frown upon. So that came up on Sunday in our academy group as well. Julie Gilkerson is in Nova Scotia, and she has pretty much all been shut down. And so the question, or the comment that she made was, I don't know if we're going to be here in a month. And so that kind of sparked this conversation. And I think it's really important for us to recognize that we've also got staff that is probably worse off than we are if we're not paying them. So part of that is putting in perspective that this is going to pass and we will be back to normal. We want to keep those really good people, and we want to be able to pay them, if we can, what we pay them now, and also to make it really cohesive in your practice. And I have just Annie and Jennifer's is my physical practice, but you guys have a lot of people, and you've got a lot of responsibility to them as well. So taking a hit ahead of time with lines of credit, if you need that, I think is the best advice that I can give, because you're going to want those people, those good people, back when all of this blows over, because the patients that didn't get care during this time, it's going to, I have a feeling it's going to be no holds barred on your door if once this is over, because they're going to all be wanting to get care at once. They found the security that it is over, so their cash is not, they're not holding on to their cash like they are now. So I think that's a big point that maybe a lot of us don't think about, is the fact that we've got to, sometimes we've got to take it in the chin and do whatever we can to keep our staff on board. And guess what? You tell your staff that you're behind them in this thing no matter what. And if there's any doubts, and I think we had a couple of people talking about that as well in one of the meetings I've had recently. It's just a boon to your culture and the attitude in the hospital and how everybody gets along. It's one big stressor out of the way if they know they've got a paycheck a month from now and they don't have to worry about that.
One thing that I did, and it took like no time to do it, is I've got a huge building and I had $1 million mortgage. I texted my bank and said I want to pay interest only for the next 3 or more months. They sent me a form. I signed it, faxed it back to them. That's already in place, and it took maybe 2 minutes total time to do it. They were happy to know that I was willing to pay interest on it, and yeah, I'll pay 3 more months at the end, or that could be extended. I could pay 18 months. But that frees up $3,000 or $4,000 a month for me to pay employees. And
excellent.
Keeps my 800 or 830 credit score indefinitely. So, those things are, those little things are going to be things that are so much easier to take earlier than later.
Excellent, MJ. And that reminds me that if you don't have a mortgage and you lease, that's another source. Write or call your landlord and say, hey, can we put 3 months payments on hold until the back end of the lease? And all they can do is say no, but probably what's going to happen, it's going to open up a conversation that results in some abatement. So that's another way that you can do that if you're on a lease as well. And we have done that. My wife is in the process of doing all those things, and hopefully we'll never need that. But if this thing goes out months and months and months, it's good to have it already in place and have that cash when you need it for what you need it for. The other thing I mentioned, that SBA 7 loan is kind of a fast track SBA loan. And I think they've just fairly recently, not during this crisis, but fairly recently offered that. And if you've ever had to go through the paperwork of an SBA loan, you know they're really, really long and difficult. But, and I don't know this personally, but Lisa is about to go through this, so I can comment on it at some point later. But evidently the paperwork and the amount of time that you have to spend to get this thing submitted is much less, and the turnover is a lot quicker. And the amount is a static amount of $350,000. So, that helps helps a lot in most cases. So that's available too. All right. Anybody else have any?
Sheldon,
go ahead.
Sheldon's asking if he can speak. Go ahead, Sheldon, for sure. Let me, 1 second. Sorry, Sheldon. Let me unmute you. I see you. Sorry, there's a lot of people here. Just gotta search for it. There we go. All right. I'm going to unmute your phone, Sheldon, okay? Let me see here. Unmute. Not letting me unmute the phone.
Is it Sheldon?
Yes.
S-H-E. I'm right here. I'll unmute him.
Okay, great.
I'm trying.
Yeah, for some reason it's not letting me unmute.
Yeah, it's not letting me either.
So Sheldon, if you can go down to the bottom left-hand corner of the controls there, there's a button that says mute. Click on that button. There we go. We got you now.
Oh, hold on a minute. Okay, can you hear me?
Yes.
Can you hear me?
We can.
Okay, I can't hear you guys now, so I don't know why not. But anyhow, I had my phone on at the same time. This date of April 15th, I don't think it's a prediction of when this is going to be over. I think it's a goal to try to start getting some people back to work to get the economy rolling again. What I think one of the goals is that the younger people, many of the younger people can actually have an infection and not even know it. And a lot of them don't even show symptoms. And so if those people can be tested and found to be positive and they have an antibody titer against this coronavirus and they don't have any symptoms, the thought process is that maybe they had the infection and they're immune, and those people could possibly come back to work and not be a source of reinfection for anybody else. I think that's one of the goals here. And I want to talk about the ventilators. If people are thinking about donating ventilators and you're expecting to get them back, I'm not sure you'd want them back after they may have been used on a COVID-19 patient. So that's my opinion.
Yeah, good thoughts, Sheldon. Definitely good thought. Thank you for that.
Hey, Dr. Beckman, this is Andrew Schultz with Midmark. If you just got a minute.
Hey, Andrew.
Hi. Hello, everyone else. I'm the Director of Business Development and Clinical Services for Midmark, and we do sell the Hollowell veterinary ventilator. We've been in contact with Stetson Hollowell directly to just get clarification, and he's told us that the ventilator in its current form is not usable on humans. My question, because we had been asked this over the last couple of weeks several times, we carry an inventory and was whether we'd be able to use them, donate them, or what have you. And they are not human grade devices by any means, not manufactured to FDA standards or anything. But you know, given some of the discussion here and just considering the idea of a life or death situation, I thought it'd be important to reach out to find out if it could be used. His response was that it cannot be used, but they are working on some modifications currently to change that. So once we have more information about what those modifications are, where they could be made, and what that would cost, we'll get that out to the community.
Excellent. Excellent, Andrew. And guys, if we don't have, correct me if I'm wrong in this, Brandon, but we don't have access where we can get information to this group again, do we, through the Zoom database?
We don't, no.
Okay. So if you guys want updates on any of the stuff we're talking about, Brandon, why don't you just put our Facebook group, one of you.
Okay, yeah.
You just put the veterinary dentistry Facebook group on the chat and the link, and you guys can join that if you're not already a member, and then we'll post those updates there, and we'll also post them in the Academy site too. But that's an easy way for us to get that information to you.
And Brett, one more thing, we're both Midmark and Stetson Hollywell are supporters and sponsors for VEX, where that it was referenced earlier that there's a donation form or a ventilator request form there that can be filled out. We'll make sure that once we have that information on the Hollywell ventilator, that information is passed on to VEX so they could also publicize it there.
Excellent. So that's a Veterinary Emergency Critical Care Society website. Is that correct?
Yes, veccs.org.
Okay, perfect.
I had a quick question here, Brett, from JFC. They said, does anybody have success talking with insurance companies for payment relief as well? Which is a great question.
Anybody at all? Doesn't look like it.
I would call everybody. I mean, I've even heard people talking to cell phone providers and utility companies and, everything with success. So I would talk to everybody.
Excellent. People just want to help. It's kind of a great feeling to know that they're resilient during these times, and I've heard a lot of instances kind of like that. So yeah, it makes you feel good in a way.
Can I just add something along the lines of helping?
Exactly.
I'm currently stuck at home, actually in quarantine myself. So I'm happy to help anybody that needs help, from home. If you have questions about protocols or things like that you need help with, I'm happy to share. There's also a really good source, Scott Weiss, that I just read this morning on VIM about PPE and things like that. That's a really good resource. But I'm happy to help in any way I can from home as well.
Perfect, Jennifer. Thanks so much. Would you put your contact information in the chat for anybody?
Sure.
And your degree, your master's was in public health?
Yes.
Yeah. So she's a great resource from that standpoint too.
Can I add something?
Sure.
I'm an EMT, and my EMS organization is reaching out to anybody in the public or in business who has PPE that they can donate. I heard earlier there was a conversation of how do you reach out or where do you find out how to donate things. You can contact your local EMS. You can also contact your hospital in your region, and they will have methods to give you. They'll give you the methods to make those donations if you want to do so.
Excellent.
A lot of places also have an MRC, the Medical Reserve Corps, and they can direct you too if you want to look at call your local health department director, and they'll also give you some advice.
Excellent. Very insightful. So guys, does anybody else have anything they want to add? I think this has been incredibly helpful. It's been incredibly helpful for me to put a lot of things in perspective, and I hope you guys have gotten out of it as well. We're here as long as we need to be for this. We're going to be doing this again on Sunday, and we're going to reach out to people who are not in the veterinary dentistry group, starting as soon as this meeting's over. And so we should have a different perspective there from all industries across veterinary medicine, if we get the response that we think we will. So that'll be at 9 a.m. on Sunday. And Brandon, if you want to post that link in chat, and that way everybody will have that. And we're going to we'll send out another email for that. And that's probably how you guys got on here in the first place. So does anybody have anything that they want to add before we close?
I'd like to make a final comment.
Sure.
I'm on the National Veterinary Response Team. I've taken training on how to be a PIO, a Public Information Officer. And I just want to caution everybody to, or not caution you, but just make you aware, and a lot of people may know this already, but when you're watching the television and you're seeing people give reports on what's going on, part of what people are trained to do in these situations is to try to reduce panic in the public. And they do that by trying to be a little bit optimistic while they're trying to be realistic at the same time, because panic is sometimes worse than the actual situation. And so just keep that in mind, that a lot of times what we hear is try to reduce the amount of panic that we're getting in the society.
And just to clarify, Sheldon, on that, are you speaking from the perspective of agencies or the media, or both?
I have not had the opportunity to actually speak for an agency, but I was trained at Anniston, Alabama to be a public information officer. So if that opportunity came up when I was on my team on a deployment, they could utilize my skills in that direction.
I'm sorry, I didn't make that clear. In other words, when they're attempting not to come across to incite panic, are you speaking from the perspective of a public agency doing that, or are you speaking from the perspective of the media attempting to do that as well?
No, not the media. This is
okay.
When the people that are standing behind the microphone, when you hear these press conferences, they try to give you as much information as they can without giving too many details that might cause unnecessary panic.
Thanks for clarifying that.
I'll give you an example. When they were dealing with the avian flu, and in situations like that, they were scared to death that they could cause an economic collapse if they did anything to cause people to stop buying chicken.
Wow.
Trucking companies and egg producers and poultry producers, you have no idea the actual volume of dollars that is involved in that industry, and the effect it would have if it totally collapsed just because of the fear. And you can see what happens with just a couple little minor incidences. It doesn't take much to cause a fear reaction.
Wow. Hey, Sheldon, you're a great resource from outside of our perspective. Would you mind just sending me an email and that way I'll have your email address, and if we can, we'll keep in touch during this. Okay.
Yeah, I've been on the National Veterinary Response Team. It used to be called the Veterinary Medical Assistance Team, but then they switched over, and now we're completely. I'm a temporary federal employee of the Health and Human Services under the National Disaster Medical System. So we respond to natural and man-made disasters and things like Katrina, 9/11, and so forth. I'll be
excellent.
glad to send you that.
And thank you. And if you don't mind, in the chat as well, my email is veterinarydentistry@gmail.com.
Yeah, I get your notices. Thank you.
Okay, excellent. Other comments? Great, guys. Well, thank you so much for getting on this. We had quite a few folks in here at one time, almost 60 people. So very happy that we could reach out. Anything that we can do for you guys from our standpoint, let us know. And we will do this again on Sunday. You're more than welcome to come. You guys have been a tremendous asset to everybody in the group. So thanks again. And we'll hopefully see you Sunday. If not, let us know if we can help.